Are you looking for an effective way to regulate your heart rate and improve your cardiovascular health? Look no further than the Ivabradine mechanism of action. Ivabradine is a medication that targets the heart's pacemaker cells, helping to slow down the heart rate and promote healthy circulation. Through its unique mechanism of action, Ivabradine specifically inhibits the action of the hyperpolarization-activated cyclic nucleotide-gated (HCN) channels, which are responsible for the heart's electrical activity. By blocking these channels, Ivabradine reduces the heart rate without impacting the force of contraction, making it an ideal choice for those with conditions such as angina or heart failure who require heart rate control. One of the key advantages of Ivabradine is its selective action, meaning that it primarily targets the pacemaker cells of the heart without affecting other organs or systems in the body. This targeted approach helps to minimize side effects and makes Ivabradine a safer option for patients. If you're looking for a medication that can effectively regulate your heart rate and support your overall cardiovascular health, consider exploring the Ivabradine mechanism of action. Talk to your doctor today to see if Ivabradine may be right for you. Understanding heart rate and its importance in cardiovascular health. The heart rate, or the number of times the heart beats per minute, plays a crucial role in maintaining cardiovascular health. A normal resting heart rate for adults ranges between 60 to 100 beats per minute. A higher heart rate may indicate an increased workload on the heart, while a lower heart rate may suggest a reduced cardiac output. Maintaining a healthy heart rate is vital, as it ensures adequate blood supply to the body's organs and tissues. When the heart rate is too high or too low, it can lead to various cardiovascular complications. For instance, a consistently high heart rate can strain the heart, increasing the risk of conditions such as hypertension, heart failure, and coronary artery disease. On the other hand, a low heart rate may impair blood flow, causing symptoms like dizziness, fatigue, and even fainting. Monitoring and regulating heart rate is, therefore, an essential aspect of cardiovascular health. Medications like Ivabradine can help achieve this goal by specifically targeting the heart's pacemaker cells. The role of Ivabradine in regulating heart rate. Ivabradine is a medication that belongs to a class known as selective sinus node inhibitors. It acts specifically on the sinoatrial SA node, which is often referred to as the heart's natural pacemaker. The SA node generates electrical impulses that regulate the heart's rhythm and determine the heart rate. Unlike other medications that affect heart rate by altering the force of contraction, Ivabradine focuses solely on reducing the heart rate. By selectively blocking the HCN channels in the SA node, Ivabradine inhibits the flow of sodium and calcium ions, which slows down the electrical activity in the heart. This results in a reduced heart rate without compromising the heart's ability to pump blood effectively. The unique mechanism of action of Ivabradine makes it an attractive option for patients who require heart rate control without the risk of negatively impacting cardiac function. It allows the heart to work more efficiently by lowering the heart rate without affecting the force of contraction, promoting better circulation and reducing the strain on the heart. How Ivabradine works on the sinoatrial node? To understand how Ivabradine works on the sinoatrial node, it's important to grasp the concept of hyperpolarization-activated cyclic nucleotide-gated HCN channels. These channels are responsible for the spontaneous generation of electrical impulses in pacemaker cells, such as those found in the SA node. When Ivabradine is administered, it selectively binds to the HCN channels present in the SA node. By doing so, it blocks the inward flow of sodium and calcium ions that are responsible for depolarizing the cell membrane and initiating the electrical impulses. This inhibition leads to a prolongation of the diastolic phase, effectively slowing down the heart rate. It's worth noting that Ivabradine does not affect other ion channels involved in the contraction of cardiac muscle cells. This means that the force of contraction remains unaffected, allowing the heart to pump blood effectively while maintaining a lower heart rate. The result is improved cardiac function and better overall cardiovascular health. Benefits of using Ivabradine for cardiovascular health. The use of Ivabradine for cardiovascular health offers several benefits. One of the primary advantages is its targeted action on the heart's pacemaker cells. Unlike other medications that may have systemic effects, Ivabradine predominantly acts on the SA node, reducing the risk of adverse effects on other organs or systems in the body. By slowing down the heart rate, Ivabradine helps to alleviate symptoms associated with conditions like angina and heart failure. For individuals with angina, a reduced heart rate means less demand for oxygen from the heart, reducing the likelihood of chest pain. In heart failure patients, Ivabradine can improve exercise tolerance and reduce the risk of hospitalizations related to heart failure. Furthermore, Ivabradine has shown potential in reducing the risk of cardiovascular events in certain patient populations. Clinical studies have demonstrated its efficacy in lowering heart rate and improving outcomes in patients with chronic heart failure and left ventricular dysfunction. This makes Ivabradine an important therapeutic option for individuals at risk of cardiovascular complications. Conditions that may benefit from Ivabradine treatment. Ivabradine is primarily indicated for the treatment of stable angina and chronic heart failure. In patients with stable angina, Ivabradine can help reduce the frequency and severity of chest pain episodes by lowering heart rate and decreasing the heart's oxygen demand. This can significantly improve the quality of life for individuals with angina, allowing them to engage in physical activities with minimal discomfort. For individuals with chronic heart failure, Ivabradine is used as an adjunct therapy to standard treatment regimens. By lowering heart rate, Ivabradine improves symptoms such as breathlessness, fatigue, and exercise intolerance, ultimately enhancing the patient's overall quality of life. It may also reduce the risk of hospitalizations related to heart failure and improve long-term outcomes. It's important to note that Ivabradine is not suitable for everyone and should only be used under the guidance of a healthcare professional. The decision to initiate Ivabradine treatment depends on various factors, including the patient's medical history, current medications, and overall cardiovascular health. Your doctor will evaluate your individual circumstances and determine if Ivabradine is the right choice for you. Dosage and administration guidelines for Ivabradine. The dosage and administration of Ivabradine may vary depending on the specific condition being treated and individual patient factors. It's essential to follow the instructions provided by your healthcare provider and adhere to the prescribed dosage regimen. For the treatment of stable angina, the usual starting dose of Ivabradine is 5 mg twice daily. The dosage may be adjusted based on the individual's response and tolerability, with a maximum recommended dose of 7.5 mg twice daily. Regular monitoring of heart rate and symptoms is important to ensure optimal dosing. In the case of chronic heart failure, Ivabradine is typically initiated at a dose of 2.5 mg twice daily. The dosage may be increased to a maximum of 7.5 mg twice daily based on the patient's heart rate and tolerability. Regular follow-ups with your healthcare provider are necessary to assess the effectiveness of the treatment and make any necessary adjustments. It's worth noting that Ivabradine should be taken with food to improve absorption. Missing a dose should be avoided, but if it happens, the missed dose should be skipped and the regular dosing schedule resumed. Possible side effects and precautions when using Ivabradine. Like any medication, Ivabradine may cause side effects in some individuals. The most common side effects reported include temporary visual disturbances, such as blurred vision or brightness in the field of vision. These side effects are generally mild and reversible, usually resolving spontaneously within a few minutes or hours. Other potential side effects of Ivabradine include dizziness, headache, and bradycardia, abnormally slow heart rate. These side effects are generally well tolerated and tend to improve over time as the body adjusts to the medication. However, if any side effects persist or worsen, it's important to consult your healthcare provider for further evaluation. It's essential to inform your healthcare provider about any pre-existing medical conditions, allergies, or medications you are currently taking before starting Ivabradine. Certain conditions may require caution or close monitoring when using Ivabradine, such as liver or kidney impairment. Additionally, Ivabradine may interact with other medications, so it's crucial to disclose all the medications you are taking, including over-the-counter drugs and supplements. Alternative treatments for regulating heart rate. While Ivabradine is an effective medication for regulating heart rate, it's important to note that it may not be suitable for everyone. Alternative treatments may be considered depending on individual patient factors and the specific cardiovascular condition being treated. Beta blockers are a commonly used class of medications that can also lower heart rate. They work by blocking the effects of adrenaline, reducing the heart's workload, and promoting a slower heart rate. Beta blockers are often prescribed for conditions such as hypertension, angina, and arrhythmias. Calcium channel blockers are another class of medications that can be used to regulate heart rate. They work by slowing down the movement of calcium into the heart muscle cells, leading to a reduced heart rate and improved blood flow. Calcium channel blockers are commonly used to treat conditions like hypertension, angina, and certain arrhythmias. It's important to consult with your healthcare provider to determine the most appropriate treatment option for your specific condition. They will consider factors such as your medical history, current medications, and overall cardiovascular health to develop a personalized treatment plan. Conclusion: the potential of Ivabradine in improving cardiovascular outcomes. The Ivabradine mechanism of action offers a targeted and effective approach to regulating heart rate and improving cardiovascular health. By specifically inhibiting the HCN channels in the heart's pacemaker cells, Ivabradine slows down the heart rate without affecting the force of contraction. This makes it an ideal choice for individuals with conditions such as angina or heart failure who require heart rate control. Ivabradine has shown significant benefits in reducing symptoms, improving exercise tolerance, and potentially reducing the risk of cardiovascular events in certain patient populations. Its selective action on the heart's pacemaker cells minimizes side effects and makes it a safe option for patients. If you are experiencing symptoms related to heart rate irregularities or have a cardiovascular condition that requires heart rate control, it's important to consult with your healthcare provider. They can evaluate your individual circumstances and determine if Ivabradine or an alternative treatment option is the most appropriate choice for you. Remember, maintaining a healthy heart rate is crucial for optimal cardiovascular health. By working closely with your healthcare provider and exploring treatment options like Ivabradine, you can take proactive steps towards regulating your heart rate and improving your overall cardiovascular well-being. Thanks for watching.